Okay, so we are finished with that and we're continuing our lecture. Now, this might be the last part of the lecture. We'll see if time permits, okay? All right, let's see. There are situations when you tend to breathe a lot and then breathe too little. Okay? We call that hyperventilation and hypoventilation. Now, sometimes your body can tell your brain, oh, it's time to breathe a lot. Okay, so let's talk about hyperventilation. What happens during hyperventilation? When a person hyperventilates, what happens is the blood has increased amount of carbon dioxide. Okay? The reason why your body tells you to hyperventilate is because you have too much carbon dioxide in your blood. And in this situation, that causes a lot of acid to be produced, and so the blood pH is acidic. And so in this situation, you have acidosis. As a result, to stop you, okay, from what's happening, okay, we have what we call hyperventilation. Hyperventilation is when you breathe more rapidly. That means you take in more breaths than normal, okay? What happens is, as you take in more breaths, you blow off more carbon dioxide. That means you're exhaling more carbon dioxide, okay? And when this happens, you tend to restore your blood pH back to normal. And Bella is screaming. Sorry. Okay, hold on. Mommy is lecturing. Okay? All right, let's see. If we have hyperventilation, then we have hypoventilation. Hypoventilation is a result when blood becomes alkaline or you have alkalosis. Okay? So instead of breathing rapidly, you tend to breathe slowly. You take more shallow, deep breaths. Okay? Now, the reason for this is because you want more carbon dioxide to be produced in your blood. Okay? Because the more carbon dioxide you have in your blood, that means you have more carbonic acid. Okay? And it causes your alkaline blood to be normalized, okay, by putting in more carbonic acid. So, that's the difference between hypoventilation and hyperventilation. You should be able to differentiate them and explain exactly what is happening to the pH when these situations occur. Okay? All right. Respiratory disorders. Unfortunately, because of sin, humans tend to have diseases. We were not created with that, but because of sin, we do now have them. Okay? The first disease and disorder I want to talk about is called chronic obstructive pulmonary disease, COPD. Okay? When a person has COPD, that means the person can have chronic bronchitis or the inflammation of the bronchi and emphysema. Now, chronic obstructive pulmonary disease is the major cause of death and disability in the United States. That means there's a lot of people that die because of this disorder. Okay? Now, let's talk about what this disease is. Patients almost always have a history of smoking if they have COPD. That means if a person smokes, the chances of them having COPD is higher than those who doesn't smoke. Okay? They tend to have what we call dyspnea. Dyspnea is labored breathing. That means they have hard time breathing. Okay? And the more severe the diseases, then the harder it is for them to breathe. Now, they tend to cough a lot, and they have frequent pulmonary infections. The reason for that is because now their lungs are not as strong as they're supposed to. Okay? Alright, so that is chronic obstructive pulmonary disease. Now, here's more features of the disease. Most victims are hypoxic. Okay? Hypoxic. That means they tend to, let's see, I looked at the meaning of hypoxic earlier, if I'm not mistaken. They tend to breathe less, okay? They take to inhale less, okay? And so they tend to have what we call acidosis, because now they tend to retain carbon dioxide because they don't exhale it as they should. Okay? Now, eventually, people who are infected with COPD will develop respiratory failure. Okay? Now, chronic bronchitis, that means the bronchi are always inflamed. Okay? What happens is mucosa, these are the mucous membranes of the lower respiratory passages, become very, very, very inflamed. The result is mucus is always produced. Okay, mucus is always produced. That is fine. You always have mucus in your bronchi. But during the situation, the production is increasing. So that means the person has a pulled mucus, and it kind of interferes with the ventilation and the gas exchange of the person. Now, people that has chronic bronchitis has a risk of lung infection. At least their risk is higher. Okay? And they tend to have what we call pneumonia. And pneumonia is when your lungs tend to have water. Okay? That's what we mean by pneumonia. And people that has chronic bronchitis are also called blue bloaters. Okay? Blue bloaters because they tend to have hypoxia. That means they don't breathe in oxygen as much. And so, the less oxygen you breathe in, you tend to be blue. See how they have cyanosis. Cyanosis means their pigmentation is more on the blue side. Okay? No, they're not as blue as the Smurfs, but they are on the blue side. Kind of purplish, okay? We've seen people that have choked or couldn't breathe, okay? I've seen it in movies. I haven't really seen it in real life. But they tend to be more bluish. Okay, so people with chronic bronchitis tend to be blue bloaters. Emphysema, okay? Again, these two are what COPD patients usually have. When a person has emphysema, what happens is their alveoli becomes large. Okay? Alveoli are supposed to be small and tiny. In this situation, they are enlarged. So, that means they have chronic inflammation. That means they have inflammation and causes what we call lung fibrosis. For people with emphysema, there's a chance that, well, normally they would have their airways collapse during expiration. That means when they exhale, the airways tend to collapse, which kind of complicates the fact that they're exhaling. They cannot exhale all of the carbon dioxide that they need. Now, patients use large amount of energy to exhale, because if they don't, that means they can't get out all the carbon dioxide. Okay? Their lungs tend to be overinflated. Okay? And at the late stage of the disease, they tend to have that blue pigmentation. But during the beginning, they're called pink puffers. The reason for that is because when they exhale, they have to expend all energy. And you know, if you try to expend a lot of energy, you tend to be reddish. Okay, so that's why in the beginning they become pink puffers. But as their disease gets worse, they become blue bloaters. Okay, so that's what cyanosis means. Okay, let's see what's next. Lung cancer. This accounts for about 1/3 of all cancer deaths in the United States. That's a lot. Okay, now the incidence of lung cancer increases when a person is smoking. So chances of a person that's smoking to have lung cancer is higher than those who does not. Okay? Now, there are 3 common types. You have squamous cell carcinoma, adenocarcinoma, and small cell carcinoma. Now, the differences between the 3 is which type of cell in the lungs are being affected and are cancerous. Okay? So, lung cancer. Don't smoke. I want you alive. So, yeah. Okay. Next. Developmental aspects of respiratory system. How do they develop? In the fetus, I don't even know how to pronounce this. Fetus. Okay, whatever. Okay. For babies in the tummy, okay, their lungs are filled with fluid. It's not filled with air. Okay. And they're not fully inflated until 2 weeks after birth. Now, that's one of the reasons why babies, when they come out of their mother's womb, they are forced to cry. The reason for that is because once they cry and they let air in, the fluid dissipates or moves away, and now the air passages are filled with air and the alveoli are inflated. Okay? Now, you have surfactant. Those surfactant make sure that your alveoli do not collapse between breaths. Okay? Because it's keeping it to have that difference in pressure. Now, let's see. Respiratory changes throughout life. Depending on how old you are, the amount of respirations or breathing you have per minute changes. So newborns tend to breathe in and out about 40 to 80 times per minute. Infants, 30. When you go to age 5, then it decreases to 25. Adults is between 12 to 18 respirations per minute. The older the person gets, the lower it is. Okay? So, rate often increases somewhat with old age. So that means, because now old people needs air, they tend to breathe faster. Okay? And they take more breaths. Okay. We're almost done. Homeostatic imbalances. Okay? We have what we call infant respiratory distress syndrome, IRDS. That means their lungs and their alveoli don't have a lot of surfactant. As a result, their alveoli tends to collapse. Okay? Cystic fibrosis. This is genetic. A lot of children are born with this. As a result, they have their mucus membrane producing too much. They oversecrete mucus. As a result, they clog up the respiratory system. And so, a child cannot breathe because now there's too much mucus clogging that up. Okay, so what else? SIDS. S-I-D-S. Okay, it's called Sudden Infant Death Syndrome. When Bella was a baby, I was always scared and I always watched her sleep because I am scared of this syndrome. Okay? This is when a healthy infant just stops breathing in the middle of the night and they would die during their sleep. Okay? Some cases, they think that the problem is because now the neural respiratory control center is messed up. Some of them, they don't have the correct rhythm. They have rhythm abnormalities in their heartbeats. Okay? And some research have shown that genetic component can affect SIDS. Okay, so when you get to that point when you have babies, okay, make sure you watch them and the doctors will tell you how to kind of avoid SIDS to occur. Now, asthma. Asthma is when the bronchioles are hypersensitive and they tend to be inflamed all the time. And so people with asthma tend to breathe and they have dyspnea. That means they have a hard time breathing. They always cough and they have a wheezing breathing. Okay, that means when they breathe in and out, they wheeze, they make this wheezing sound. And then finally, we have aging effects. The older a person gets, the harder it is for them to breathe. The reason for that is because their lungs have less elasticity. Vital capacity decreases. That means the amount of air that they breathe in and out is less. Blood oxygen decreases. And carbon dioxide also decreases. Okay? So, the elderly a person gets, they're hypoxic. That means they don't breathe as much air. And they tend to have what we call sleep apnea. That means in the middle of their sleep, they'll just stop breathing. Okay? Now, old people also have more risks of respiratory tract infection. And that is the end of chapter 13. So please don't forget to study this. This will be part of our test on Wednesday. All right. So your sub will have the instructions for what you will do during lab and for the time that you have remaining during class. Okay. So hope to see you soon once I am well. Goodbye.